Hello everyone, how are you today? It's been a while I've done a live. I've been doing regular weekly videos, but I haven't done a while in a long time. And this month I've been talking a lot about diabetes, especially diabetes type 2. Why? Because diabetes is one of the 4 killer diseases, and we can do our best to prevent ourselves from getting the disease. So let me say this. We have diabetes type 1, which is an autoimmune disease where the body begins to attack itself. Hello everyone, thanks for joining me. Where the body begins to see the body as an enemy and begins to attack itself. Now, that's an autoimmune disease which is sort of out of our control a lot of times. Then the other type is diabetes type 2, which are the risk factors and causes are in our hands. We can do something about it. And it's based on our lifestyle, on our diet, lifestyle and diet, and our genes. So we need to understand that. So if there's a family history, it can happen. So we can control that. And also you have gestational diabetes, and that is diabetes that some women get when they are pregnant. But it doesn't mean they're going to get full-blown diabetes. But if they're not careful, if they don't stay with their doctor and follow up and change their lifestyle and their diet and exercise, it's most likely they'll develop full-blown diabetes. I know people that had gestational diabetes and today have full-blown diabetes. And that's because they didn't have the knowledge, they were ignorant and just continued to live life anyhow and thus developed full-blown diabetes. So knowledge is key. And then there's what you call diabetes type 3, which is Alzheimer's, which they call brain diabetes. So they're saying Alzheimer's is actually diabetes of the brain. So we also need to be careful even when we are eating, to matter in the future, because it can happen in the future. So what we do today can affect what's going to happen to us tomorrow. So look at the diabetes types. So we've already said diabetes 1 is really not much you can do. Now, what is the real cause of diabetes type 2? Diabetes type 2 is not high blood sugar. And I want us to understand this. High blood sugar is a symptom of the disease. Diabetes type 2 is a metabolic disease, and the root causes are when there's beta cell dysfunction. That's number 1 root cause. And number 2 is insulin resistance. So when these 2 dysfunctions are there, the end result is high blood sugar. So when you begin to treat high blood sugar, you're just treating the symptoms. You're not treating the root cause. So you never get the results that you want. And diabetes is not a disease to be toyed with because it has a knack. It's one of the most destructive diseases. The complications of the disease are out of this world. And it's a killer disease. In fact, diabetes and aging, they are friends, they are family, they are parallel, they go together. So people with diabetes age more quicker than people that do not have diabetes. Okay, and it has a knack of destroying lots of organs like the kidneys. So imagine somebody who has diabetes and also has high blood pressure. High blood pressure has a knack of destroying the kidneys. So somebody who has those 2 is a double whammy. And when people develop kidney disease, it's a horrible disease. So those are part of the complication of the disease, why we